Whenever I meet doctors, hospital managers, or procurement officials, and I say the words IoT medical devices, the fast reaction is, अच्छा, ये क्या होता है? What is IoT? Why should we care about it? And where do we actually use these devices in day-to-day healthcare practice? A normal device like BP monitor, glucometer, ECG, pulse oximeter, it just gives a reading. And IoT medical devices does the exactly same thing. Just imagine, instead of writing 160 by 100 in a register, instead of taking a photo of the glucometer screen, instead of sending a picture of ECG on WhatsApp, traditional method, what you will do, measure, write on paper gets torn, the IoT device method. BP, reading goes directly to tablet, phone, cloud, a PDF report auto-generates, patient gets an SMS or through WhatsApp, everyone gets a live dashboard, everything becomes clean, fast and traceable.
Welcome to Digital Health Adoption. Learn, implement, transform.
Hi everyone, I am Dr. Lalit. Today I am to talk about something that honestly creates confusion everywhere I go. Whenever I meet doctors, hospital managers, or procurement officials, and I say the words IoT medical devices, the fast reaction is, अच्छा, ये क्या होता है? Connected device का मतलब क्या है? And it's completely fair. These are tech world words, not medical words. So today let's drop all the jargon and let's talk real in layman terms. What is IoT? Why should we care about it? And where do we actually use these devices in day-to-day healthcare practice? Not theory, real ground level scenarios. Let's come to IoT or connected medical devices. Let me explain this in the simplest possible way. A normal device like BP monitor, glucometer, ECG, pulse oximeter, it just gives a reading. And IoT medical devices does the exactly same thing, but it also sends that reading automatically to your mobile phone, tablet, computer or cloud. That's literally it, nothing fancy. You take a measurement, the reading appears on your phone, the doctors can see it instantly and it gets saved for future. Just imagine, instead of writing 160 by 100 in a register, instead of taking a photo of the glucometer screen, instead of sending a picture of ECG on WhatsApp, the device itself pushes the data automatically without mistakes. I mean, think of it like medical device plus internet equal to connected medical device. Bus, it's so simple. Then let's know why is it important. You may ask, okay, device sends data, so what? Let me share the real benefits we actually see on the ground. Number one, zero manual errors, no wrong BP entries, no incorrect sugar values. It just saves times and nurses are not stuck with writing vitals over here and there. Number three, creates instant digital history. When patient comes after 6 months, all readings are already there, no guessing. So number four, it's perfect for Telemedicine doctors sitting anywhere can see accurate vitals. I mean, whenever they consult, they see the vitals automatically in the screen. Number five, alerts for high risk patients if BP spikes or sugar crashes. The system automatically flags it. Number six, ideal for government screening programs. Big camps can be digital without extra effort. I mean, IoT is not important because it's fancy. It is important because it is practical, clean, and error free. Let's talk about real use cases we see every day. This is most important part. Where do we actually use IoT medical devices in real scenarios? Health screening camps. Imagine you are running a screening camp involving devices like BP, sugar, ECG, lipid, HbA1c. For a screening camp around 300 to 500 people, traditional method, what you will do, measure, write on paper gets torn, somewhere later types into Excel, errors everywhere, almost no follow-up possible because so many papers piled up. Now let's see how the IoT device method. BP reading goes directly to tablet, phone, cloud. Sugar appears instantly. ECG, doctor sees the graph in real time. A PDF report auto-generates and patient gets an SMS or through WhatsApp. Everyone gets a live dashboard. Everything becomes clean, fast, and traceable. I have personally seen camps where thousands plus people were screened smoothly. I mean, just because the data was automated. Let's talk about another use case like outreach OPDs or mobile health units. In rural clinics or mobile health units or any community health programs, IoT is a game changer. In the traditional method, vitals goes into a register, next month nobody remembers anything. With an IoT, paramedic measures vitals, values, it automatically sync into doctor's dashboard and doctor sees it live from inside the van or remotely, I mean in case of mobile health units. A digital history gets built, follow-ups becomes possible. One doctor can now support multiple outreach points. I mean sitting one place, having consultations with patients from different locations. This is how you scale healthcare without hiring additional staffs also. Let's talk about remote patient monitoring. This is the future of chronic care or post-op care. Common problems in home monitoring or remote patient monitoring. Patients forget, values are entered wrong. I mean, notebook or register that is given by doctors to patient is shown after 3 months. No early detection of problems. If you see with IoT, all the vitals like BP, sugar, all sync automatically. Doctor dashboard shows daily or weekly trends. Alerts or notifications are sent when limits are crossed. Care teams, I mean the nurses or the caregivers, call the patient immediately. Emergency get prevented for elderly, cardiac, and diabetic patients. This has proven to reduce hospital visits and serious complications. Let's now talk about teleclinics, like telemedicine centers. So, this is one of my favorite use cases where, I mean, these devices are really useful. usual telemedicine consult doctors practice. Doctor keeps asking BP क्या है, sugar क्या है, pulse कितना है. Half the time values are verbally communicated or approximate. With IoT, vitals taken in the teleclinic appear instantly on the doctor's screen. Suppose ECG uploads within seconds, historical trends pop up automatically. The doctor can prescribe with more confidence. You basically create a full OPD experience without the doctor physically being present. To summarize, IoT medical devices are not complicated, they are simple, normal devices that send data automatically. Why do they matter? It reduces error, it saves time, builds digital history of a patient, and strengthen telemedicine, enable early detection, and improve public health programs. What do you actually use them? It's starting from screening camps, outreach OPDs, teleclinics, and home monitoring. I mean, from rural camps to big private hospitals, every part of healthcare benefits from IoT. If you find this useful, share it with your hospital team or colleagues. Most people think IoT is complicated because it's explained in tech language, but when you look at real use cases, it's actually very simple. In my next blog, I'll take you deeper into specific devices like multi-parameter, other sleep monitoring, and other devices, and how they actually work behind the scenes. Thanks for watching.
Welcome to Digital Health Adoption. Learn, implement, transform.